In some health news, with artificial intelligence constantly in the headlines this morning, we show you how it can actually benefit those who use it, especially in healthcare. I got to talk with a family physician spearheading the initiative at one clinic in the tri-states. AI is in just about everything these days, from our phones to some of the most sophisticated computers in multiple industries. We use it to assist us in our everyday needs and to help answer some of the biggest questions we may have. That's especially prevalent in the healthcare world, where doctors can use artificial intelligence to help take notes and assist in a diagnosis. That's happening here at Northeast Family Health in Kirksville. A service of Northeast Missouri Health Council, they're currently in the testing phase of using what's called ambient listening. They've been testing this medical scribing service since June of last year, and they're happy with the results.
It does a very good job. The service that we use reports like a 95% accuracy, and I would say that is accurate in my experience.
Dr. Matthew Tilton is a family physician and the physician champion behind the AI service, basically spearheading the effort to bring it into use in the area. He says it's made his job quite a bit easier.
It allows me to have a more proper patient interaction. It helps save time on administrative tasks, and quite frankly, is less of a cognitive burden for me.
The user interface is pretty simple. All Dr. Tilton uses is his phone. The service transcribes the conversation between him and his patient. He also narrates what he's doing during examination. It then categorizes only the relevant health information, ignores the small talk, and then helps to create a document called a SOAP note. That's the subjective information from the patient, the objective info from the doctor's observations, and the clinical assessment. From there, the doctor can make a plan as to the next steps of treatment. Now that's all well and good, but one question that's on everyone's minds is, will the service, or AI in general, eventually take the doctor's entire job? Dr. Tilton says he's not worried about that.
A physician encounter is a much more human-to-human connection. AI is not going to have empathy for you, is not going to ask how your family is. So no time in the future do I ever see an AI replacing a physician in making medical decisions, getting to know your family, and getting to know what's best for you.
Dr. Tilton is also optimistic about the service being used in more corners of the healthcare world. He's seen its use in radiology as well as in some psychiatric evaluations. He also sees it expanding beyond the care of one person.
We can use AI to say, okay, this is our situation, this is our demographic. What clinical guidelines do we want to make available for all of our clinics? And then we can make procedures, we can make policies based on that, really from a public health standpoint rather than an individual basis. So I see it being used both one-on-one as well as for population health.
Of course, it's all dependent on you, the patient. You would be asked by the doctor if you would like the AI to listen into the conversation. Once again, it's only a tool that a physician can use as a note-taking service, and it does not replace the doctor's final recommendations. Dr. Tilton hopes to see the AI software fully implemented soon.